Hello everyone, my name is Oghuan. I'm a registered dietitian and nutritionist. I'm the dietitian and clinical nutritionist of the Lagos Executive Cardiovascular Center. I'll be explaining and debunking myths surrounding nutrition and diet as much as I possibly can. Today I'll be talking about dyslipidemia, which is basically a disorder of lipoprotein metabolism. Lipoprotein basically is a combination of cholesterol and proteins. So the real criminal here is cholesterol, but cholesterol is needed by the body, and it is a fatty substance which is carried around the body or carried to parts of the body where it is needed by proteins. And then this combination births lipoproteins. And then a derangement in this value births dyslipidemia. So now, in discussing this, there are three types of lipoproteins. There is the HDL, which is the high density lipoprotein. There's the LDL, the low density lipoprotein, and then there's the triglyceride. The HDL is termed the good cholesterol, LDL, the bad cholesterol, and then there's triglyceride. The good cholesterol takes fat or cholesterol away from the cells back to the liver for it to be broken down. The LDL takes fat to the cells where it is needed. And then triglyceride is formed when there's an excess amount of calories that isn't burnt off. So it needs to be stored in some way. It is now converted to fat and stored as cholesterol. So you see why the LDL is the bad guy. It takes all the fat to the cells and more or less leaves it there. So a derangement in any of these values will result in dyslipidemia. That is, if there's a high amount of LDL, the HDL comes in and then there is still some left. Now this lines the arteries of the heart and can actually cause or result in atherosclerosis that can result in a heart issue. If there is not enough HDL, there isn't enough to carry the excess fat or the excess cholesterol from the cells where it has been deposited by the LDL back to the liver for it to be broken down. If there's a high amount of calories and it is not burnt down, it is converted to triglyceride. And that is why in the management of dyslipidemia, there are three things that we emphasize: diet, medication if it is prescribed, and exercise. In the Lagos Executive Cardiovascular Center, a diet used by the dietetics department in the management of patients with dyslipidemia is the Mediterranean diet. Now this diet highlights a couple of things, some of which are a decrease in the consumption of saturated fat. It encourages consumption of monounsaturated fatty acids like olive oil. It also encourages an increase in fish intake because of the kind of oil that fishes have, and because it is seen that omega-3 fatty acid, which is found in fish, is actually great for the heart. It also encourages consumption of fruits and vegetables. Now there is a belief that I have heard from a couple of patients, and I would like to address it, that cholesterol is found in vegetable oil. No. Cholesterol is gotten from animal sources, not plant sources. What that means is you can get cholesterol from your pork, from your eggs, but chances of getting cholesterol from your vegetable oil are non-existent. However, an increased consumption or taking a lot of this can actually convert through a process and cause a problem or a derangement in your cholesterol levels. Thank you for listening. If you have any questions or concerns concerning this, please leave a comment and I'll attend to it as soon as I possibly can.